Hello, and welcome to One World, One Health, where we chat with people working to solve some of the biggest problems facing our world. I'm Maggie Fox. This podcast is brought to you by the One Health Trust, with bite-sized insights into ways to help address challenges such as infectious diseases, climate change, and pollution. A One Health approach recognizes that we're all in this together, and that everything on this planet, the animals, plants, and people, and the climate and environment, are linked. Just as you might have hoped we were all through hearing about unusual viruses, we're starting to hear about Oropouchevirus. It's not exactly a new virus, but it's been spreading more widely than seen before in Brazil and elsewhere in South America, and it's shown up in Cuba for the first time. It can be carried by mosquitoes, but unlike many other viruses, it's spread mostly by little flying insects called midges. Oropouche causes fever, headaches, chills, achiness, nausea, and can sometimes lead to inflammation of the brain or spinal cord, serious symptoms called encephalitis or meningitis. That's when Oropouche can kill people. Brazil reported 2 people died from Oropouche in July. The virus has been diagnosed in travelers coming home to the US, Germany, Spain, and Italy. So what's causing the surge? Dr. Danielle Romero-Alvarez, an epidemiologist at International University SEK based in Quito, Ecuador, says there's evidence it has something to do with the loss of forests. He's joining us to talk about the virus and what might be helping it spread. Daniel, thank you for joining us.
Thank you very much for having me here. I'm super happy to participate.
So first off, can you tell us a little bit about Oropouchevirus?
Yeah, so this is a super curious virus that has been circulating in South America for a long time. It was first discovered in 1955 in a patient in Trinidad and Tobago. Since then, multiple outbreaks have been recorded in different countries, especially in Brazil. But then it started to be discovered in Peru and Colombia and other regions before the current 2024 outbreak, which is super huge.
And this one, although it's been found in mosquitoes, it's not spread necessarily by mosquitoes, but by these little flies called midges.
The most important vector, so the insect that is transmitting the disease, which is Oropouche fever, it's a midge that it's called Culicoides paraensis. It's a midge, it's not a mosquito. It's an interesting differentiation because when you think on insects transmitting diseases, you usually think on mosquitoes, right? And the classic one is Aedes aegypti, the one that transmits dengue. But there is a beautiful picture that everybody can find online that compares a mosquito with a midge. And a mosquito is a giant in comparison to the very small size of a midge. That is something important because it's far more difficult to be aware of a very small insect that is biting you. A mosquito is a really gigantic insect. Well, it's not gigantic, but it's large enough so you can kill it and move it apart from you.
So you say that cutting down forests, this broad, vast deforestation that's going on in South America, could be helping it spread. How can that happen?
Okay, so what my research have found is that areas where you have lost vegetation are related with Oropouche fever human outbreaks. And this is an important detail to mention because the way we measure the loss of vegetation is through satellite images, right? So we basically download images from satellites and then we compare vegetation more or less before and after the appearance of Oropouchevirus outbreaks. And we found that places where Oropouche fever cases were detected had less vegetation than other places, right? So then we consistently found this on an outbreak that happened in Peru in 2016, which was the first time I heard about Oropouchevirus actually. And then we found the same pattern across 35 outbreaks that happened up to 2019. Apparently, areas with loss of vegetation are more probable to have Oropouche fever cases than other areas, right? We have tested that in my research. So we found this correlation between loss of vegetation and Oropouchevirus outbreaks. So more studies are needed to actually confirm this theory, right? And this is crucial, right? why we are not doing this study like on site, because I am from Ecuador. And in Ecuador, not so much cases have been detected in my country, but I am pretty sure that that is because in Ecuador, we are not doing a full surveillance of the virus, right? And for example, something very important to notice is that currently the reason why we are detecting so many cases of Oropouche fever in Brazil is because we are actively looking for those cases, right? Because we are aware of the epidemic. Potentially, and according to my research, the virus have been circulating in South America for a very, very long time. And we haven't detected the virus because we are not literally looking for it. There are another viruses in the region that are also overlooked because we are fully focused on dengue, right? And also because the way we study infectious diseases is in a reactive way. So there are weird cases, patients with fever. We don't understand the cause of that fever. Okay, let's look something else rather than dengue, right? This is a reactive way to actually look for pathogens. But pathogens are part of the ecosystem. Usually, we don't go to capture mosquitoes or midges and see, okay, what they have. Do they have any virus that potentially can harm humans? The way we survey for infectious diseases is this reactive way.
To be clear, you're not thinking, first of all, cutting down forests must be bad, and so now we're going to look for proof it's bad, and we're going to look for proof it spreads the virus. You saw, first off, that the virus was spreading in places where the forests had already been cut down.
Yeah, exactly. We found that outbreaks of Oropouche fever were detected in places where the vegetation was lost. There is a reason why this might be happening, right? Once the trees are taken down, then usually this new area is used for agricultural purposes. And there is anecdotal evidence showing that the vector, the midge Culicoides paraensis, loves to reproduce and to live happily in banana plantation and cocoa plantations.
Now, this might be counterintuitive to some people because you might think there'd be more insects in a forest, not fewer. What is it about a banana plantation that makes it such a great place for midges?
Theoretically, if you have more forest, you will have more insects, right? But for answering that question, you have to understand that there are this concept of not only insects, but other kind of animals and plants that prefer to live in ecosystems that are not forested, right? Like urban environments. And Aedes aegypti is a fantastic example of that behavior, right? That mosquito prefers to live in urban centers. So they have become super specialized on consuming blood from us. And the same might be happening with Culicoides paraensis. That particular vector, that particular insect prefers to live in banana plantation rather than in forests. And that's it.
And Aedes aegypti is, of course, the mosquito that spreads a lot of the really bad diseases that we've heard about, like dengue fever, like Zika.
And something interesting is that dengue is important and can be super severe and bad in some context, not necessarily in all contexts. And I am saying this because, one reason why Oropouchevirus or other obscure viruses are not studied is because in theory they are not super lethal. That's another way why we are not super aware of all the pathogens that have the potential to affect humans, because we don't see them as super lethal, right? There is another virus that is circulating across South America that is called Romero-Virus. And this virus, apparently, it's like Oropouchevirus, right? It's not super bad. So then we are not studying it at all. Potentially, we will start studying it after the next epidemic.
And one of those viruses that people didn't pay attention to for many years was Zika. Now, of course, there's evidence that, like Zika, Oropouche can cause birth defects if a woman gets infected while she's pregnant.
Yeah, two takes on that argument. The first is that we knew previously that Oropouchevirus was able to actually cause birth defects. So it was not a super surprise to find birth defects in the current epidemic that is compromising so much people. So more important that the birth defects caused by Oropouchevirus is actually that since its discovery in 1955, for the first time, the Brazilian Ministry of Health reported deaths attributable to Oropouchevirus. So people have died for the first time because of this virus. And I know this because some unofficial reports that have been circulated online, right? And that were confirmed by the Ministry of Health. But the details on how these people died have not been shared. So the only information that I know is that the people that was dead because of Oropouchevirus were two women, less than 35 years old, something like that, and nothing else. So why they died because of Oropouchevirus? That information will be crucial to understand what will happen with the epidemic in the next months.
So, however, like many viruses, Oropouche can cause meningitis, it can cause encephalitis, and those can, of course, both be deadly.
Yes, specifically, Oropouchevirus can cause meningoencephalitis, yes. But the proportion of people that actually get that particular outcome is very, very small. That is why, for example, we know about the Oropouche fever cases in the current epidemic, but there have not been so many reports about there is these people with meningoencephalitis, these people. No, only the classic presentation of Oropouche fever.
So, is there a lesson to be learned from this? People are cutting down forests in order to farm, but this might be releasing these midges that can then spread this virus. What can people do about this problem?
That's a very challenging question because at the end, in multiple occasions, the reason why people is deforesting places is because they need the land to actually cultivate the stuff to eat and at the end to earn some income and survive, right? The advice of stop cutting the forest is challenging on itself. So something that people can do if they are in this situation is literally try to apply some strategies to avoid the beating of the midges. So using repellent, try to use clothes that cover a lot of the skin and try to avoid endemic areas where active transmission is occurring. This is an important recommendation to determine what is an actual active transmission area because during the Zika epidemic, something curious that happened is that the CDC issued this prevention strategy, right? Like to avoid all areas below 2,000 meters above sea level. And if you put together a map showing which areas are above that area, so basically they were saying like you should not go anywhere. So it was such a counterintuitive prevention strategy. So first determine where is an active area of transmission and then avoid it.
Because right now, there's no vaccine against Oropouche, there's no treatment for it.
As a virus disease, the treatment is focused on symptomatologic interventions, right? To avoid fever, avoid pain, rest. And of course, yeah, because this virus has never been studied properly, of course, there is not a vaccine.
These midges aren't flying from Brazil to Cuba. Something's carrying the virus, and that something might be people.
Yeah, and regardless of the insects moving to other areas, something important is that there are many, many, many species of midges, right? The one that we know that it's an active transmitter of Oropouchevirus is Culicoides paraensis, but there are multiple other species. So if a person that has the virus travels to another country, the most important risk is that a vector from that country that lives in that country actually bite that person, get the virus, and establish an endemic transmission. And that is the most problematic and worrisome stuff on how these viruses can spread to other areas.
The perfect example of that was West Nile, right? Western Hemisphere. West Nile did not exist in the Western Hemisphere till the beginning of the 2000s when somebody carried it. And it now can be found in Kansas and in California.
Yes, exactly. And there are multiple examples of that, right? Chikungunya virus was not found in the Americas. It was an African disease, right? That is why they use the African word chikungunya. And then it was discovered here because of the way these arboviruses are currently spreading.
So that's why everybody has to be worried about deforestation in Brazil.
Yes, and not only because of Oropouchevirus. Although we are using this particular case to understand how there are places where vegetation is lost and then Culicoides is established and then outbreaks of Oropouchevirus are detected. Whenever you are deforesting a region, you are changing the ecosystem and you are incentivizing in a way that species that love to be near deforested areas proliferate, right? And species such as rodents are super important species that live in deforested areas, right? And they love to be in touch with humans and, of course, urban centers. That is why, for example, deforestation has also been linked with Lyme disease, right? Which is also another very important infectious disease in the US, right? And there is this topic about the dilution effect. And the dilution effect basically says that if you dilute the pool of species in a forest because you eliminate the forest, and of course, a lot of species cannot live in areas where you don't have more trees, then you will have a proliferation of species that can live in deforested areas, like rodents, right? And rodents are key for the life cycle of Lyme disease. I believe that it is important to talk about the case of Culex kinkefaciarus as a vector of Oropouchevirus, right? Culex kinkefaciarus, it's a mosquito. So it's not a midge, it's a mosquito. And this is important to mention because there are controversial evidence of the role of Culex kinkefaciarus transmitting Oropouchevirus. There is actually an experiment that was done in Florida, not in conditions outside the laboratory, but in a laboratory. They demonstrated that Culex kinkefaciarus might not be the best vector. However, there have been detections in the field of Culex kinkefaciarus infected with Oropouchevirus. So if you use protective clothes and repellent and you try to avoid mosquitoes, that's a recommendation that helps not only for Oropouchevirus, but for a lot of diseases. And because we don't know what mosquitoes might carry it, then we should protect ourselves.
Tell me if I'm wrong, but that little Culex mosquito, it's everywhere. And isn't that one of the ones that bites birds and helps spread things to birds too?
Yes. Yeah, that mosquito is everywhere. Actually, I have a publication that we did with some colleagues from Los Alamos National Laboratory where we updated the distribution of a lot of Culex mosquitoes in the Americas, right? Not only Culex kinkefaciarus, but a lot of them. And yeah, they are everywhere, and not only in the Americas. So they are good transmitters of diseases as well.
And of course, I think they played a role in establishing the endemicity of West Nile, if I'm not wrong.
Yeah. They transmit West Nile.
Right. They infected birds, and then birds became the reservoirs, and that's how West Nile spread everywhere. So if this darn Oropouchevirus can be spread by Culex mosquitoes, we could be in trouble.
Yeah, and something important is that, as you were correctly mentioning, right, birds, mammals, let's not forget that we as humans are mammals as well. So mosquitoes are not going to see us as, oh, humans, let's respect them. We are mammals for them. And as such, we are in this ecosystem or we are all connected. So we have to be aware of how pathogens are also part of our ecosystems and, of course, of our daily lives.
Daniel, thank you so much for joining us.
Thank you very much.
Listeners, if you enjoyed this podcast, please share it. You can find links to this and other important topics at onehealthtrust.org. And let us know what else you'd like to hear about at OWOH@onehealthtrust.org. Thanks for joining us.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Lakshminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.